Hi guys. I'm going to try to get through this without stumbling on my words. It's been a down day and I just really feel like sleeping and I'm not really feeling that well. But I wanted to go over a topic on Lyme testing and why it does come back inconclusive and negative. I'll get a little in depth on it, but not a lot, so I'll do a follow-up video where I'm talking about the spirochetes and the different infections and different strains and so on. Basically, today's testing just measures for the antibody response to infection. And if your body is used to having it in there, it's not seeing it as a threat, so it's not showing the accurate results. The two tests that they usually do is the ELISA and the Western blot. And the ELISA test just is not sensitive enough to pick up what it needs to pick up. And a lot of the problems too is different labs get different results. One might get negative, one might get positive. When I went to Bassett Healthcare, I was getting inconclusive, but when I went to Slocum-Dixon, I was getting negative. My thought is if it's coming back inconclusive like, lupus does or other things, don't you want to just try out some of the antibiotics to see if it helps any, I don't know enough about lab work and stuff, but I'm just saying it just seems like if it's negative, it's negative. And if there's anything that's not negative, well then start fixing the problem. And if it doesn't work, then maybe that wasn't a problem. They're so willing to give out drugs to fix everything else and to cover up this and cover up that. Geez, at least, help us out here. And there's two other tests. There's the antigen and the PCR test. The PCR test is much more sensitive. However, it gets inconclusive results, which is probably what Bassett used with me. And the antigen, it looks for like the Lyme protein in your blood and in your urine. I never had the urine test myself. But the problem is the protein tends to be sparse. And another thing that it does is, it hides. But with the sparseness, if they're taking 5 tubes of blood, it may not be in those 5 tubes of blood. So, your testing's going to come back, not positive, more than likely. And the antibodies have a tendency to hide, especially the Borrelia. It hides in your DNA after a while. And one other thing is it changes its coat after, so long, the outside shell of it. So it's also not seen. So there was just a quick little tip on the testing and stuff for Lyme. And I'll get more in depth, like I said, on the spirochetes and stuff later on. Thanks for watching.